I am Eileen Doherty, and I'm the director of the Colorado Gerontological Society. And this is our Wednesday Lunch and Learn in the open enrollment season for Medicare. And we're going to talk a little bit today about durable medical equipment, some of the coverages and benefits. So basically, we're going to try to look a little bit about what is covered, when, how much, and by whom. Probably some of you have seen this little graphic if you have watched some of the other presentations as part of this series. But as most of you know, struggling with what Medicare covers, what are the penalties, deadlines, etc., always is a challenge. So I went ahead and put this little graphic up just because I want to reconfirm for you that Medicare has 4 parts, A, B, C, and D. What we are concerned about today is Part B, and in this graphic, it's called medical supplies. We also are concerned with Part C, which is Medicare Advantage, because Part C covers all of A and B plus D. So by default, Part C also covers medical supplies. So durable medical equipment is known in Medicare as DMEPOS. And what that basically means is that the federal government contracts with specific agencies to be able to provide durable medical equipment. I said the federal government, basically it's Medicare. And they contract then for things like diabetes, braces, canes, crutches, prosthetics, CPAP, oxygen, wheelchair, etc. So we're going to start out this afternoon, and some of the topics are going to be in a little bit more detail than other topics, just because this started to get really long. So if some of you have more specific questions over and above what we're covering, we can certainly cover those offline. So we're going to start with diabetic supplies. What does Medicare actually cover for diabetics? So the supplies that they will cover are blood sugar monitor meters, blood sugar test strips, lancets and the lancet devices, external insulin pumps and insulin for the pump, and diabetic shoes if they are medically necessary. These are covered under Part B. So all of the medical supplies and all of the stuff we're going to talk about primarily today is only going to be covered by Part B, and then by default, because Part C or Medicare Advantage is inclusive of A and B and D, Medicare Advantage covers them as well. So in order to be eligible for coverage, you have to see a DME doctor or supplier, and they have to be enrolled in Medicare. So sometimes if you go, say, to an orthopedic doctor, they will go into their inventory and they will give you a brace or something. So one of the things that's required for a diabetic is for the doctor to be enrolled in Medicare, and then whatever supplier that you get your supplies from, they also have to be enrolled in Medicare, and they have to accept assignment. And they have to be enrolled in Medicare Part B for boy, not Medicare Part D as drugs. So pharmacies, some of them are both suppliers for Part B as well as for Part D. What assignment means is that the supplier has to accept as payment in full the 80% that Medicare pays, along with the 20% that is your responsibility or paid by a Medicare supplement. There's a lot of push at this point in time on the part of Medicare and some of the other suppliers to actually get your supplies via email, or I mean via mail. So under the Durable Medical Equipment Program, you can either get your items through mail for diabetic supplies, or you can get them through a retail store. CVS, Sam's Club, Walmart, they all have mail order options as well as in-person options that you can buy from the retail. You can also get them from Lincare, Apria, Shield Healthcare, and Premier Medical Group are just a few of the ones that actually offer both mail order as well as in-person deliveries. As I said, the diabetic supplies, you have to pay 20% of the approved charge. This is not necessarily of the bill charge, it is the approved charge. And then if you have not met your Part B deductible for the year, you also would have to pay that first. Now, this again is the supplies. This does not include the exclusions for insulin that will go into effect in 2023. If you have a Medicare supplement, they have to, by law, pay this 20% of the approved charge. And then on a Medicare Advantage plan, when I looked yesterday to see whether or not they would cover diabetic supplies, some companies have a zero copay. Some of them had a copay up to 20% co-insurance. So it really depends on which Medicare Advantage plan that you select if you go with Medicare Advantage. If you go with original Medicare and you have a Medicare supplement, then they all will cover the 20%. And I just put in here to remind everyone, if you are on insulin, starting in 2023, the cost of insulin will be $35 per vial per month per type of insulin. So if you have a long-acting and a short-acting insulin, you'll have to pay $35 for the long-acting and then $35 for the short-acting. The insulin does come out of your Part D benefit, not out of your Part B benefit. Another thing that we'll take a quick look at is knee and back braces. So again, things have to be medically necessary for Medicare to pay for them. So medical necessity in terms of knee braces has to meet one of these types of criteria. So they stabilize the knee, especially after surgery. It could be used to relieve pain and pressure for someone, say, who has arthritis. Or it could be to prevent further injury. So those are all reasons why Medicare might deem it necessary. Back braces similarly are covered, and again, it has to be medically necessary. So you have to have some type of a medical condition. Oftentimes that's known as lumbosacral orthosis. And what a back brace does is basically it has to, again, support the muscles and the bony parts of the spine. It also might provide stability. It might restrict movement so that you don't fracture or get further compression or get further damage, or it might actually provide relief from acute or chronic pain. The types of back braces that Medicare will cover are as if it's rehabilitative following surgery or an injury. If it's functional, providing some type of joint stability or decreasing pain and increasing performance. If it's either taking off or redirecting, if you will, the stress on a knee or a back. But the intent there is to limit your movement and allow then the sore area to heal, or it could be prophylactic, again, basically allowing something to heal over time. The other types of braces that are also covered are things like neck braces for cervical collars, wrist supports and braces, ankle braces, straps, guards, stabilizers, heel cushions, all of that kind of thing can be covered as well. So Medicare is going to cover these if you have a doctor's order, if it is medically necessary, and if the item is usable for a minimum of 3 years. So it has to have what we might call a useful life. The type of brace that is covered is usually either rigid or semi-rigid, and you have to purchase it from an approved provider through the competitive bidding process for the durable medical equipment, prosthetics, orthotics, or suppliers. So those contractors are listed on the Medicare's website at medicare.gov. So if you purchase it from somebody who is not in the competitive bidding program, then Medicare will not cover. The types of things that Medicare does not cover is any type of sleeves or wraparound style of braces. This could be like the ACE bandages. This could be any type of bandage that basically you use to stabilize it, but it doesn't necessarily have the same type of therapeutic impact or event. It won't cover things like heating pads or ice pads or anything like that. Similar to what is covered in diabetic supplies, the same is pretty much true for braces. Again, pay 20% of the approved charge. If you haven't met your deductible for Part B, then you have to pay that. And then if you have a supplement, that will pay the 20%. And again, when I looked online, the Medicare Advantage plans tended to be more of them were charging for co-insurance, closer to the 20%. Relatively few of them were charging zero for any type of braces. The next thing we'll look at briefly is oxygen and oxygen equipment. So again, the medical necessity that we're looking at in terms of why is oxygen therapy important? It may be because it improves or makes doing daily tasks easier because you need to get more air into your lungs. You also want to be able to exercise without having breathing issues. You may need it for sleep. You may need it for daytime alertness or even for life expectancy, given the fact that you may not be able to breathe appropriately without oxygen support. So again, medical necessity becomes really important when we're looking at durable medical equipment. By way of a little bit of background, a number of years ago, there was a lot of Medicare fraud associated with Medicare medical supplies. And so that is why there is a lot of due diligence, if you will, on the part of Medicare, as well as on the part of the providers, and the competitive bidding is to decrease that fraud. So again, as we're looking at medical necessity, we're usually looking at some type of pretty severe lung disease, and you're not getting enough oxygen into your lungs to be able to breathe properly. Usually we're looking at some type of improvement in quality of life with this type of oxygen therapy. Another reason we might be using oxygen is if your gas levels in your blood get below a certain level. That may be another reason why Medicare will find it necessary. So in the rental, oxygen equipment is rented. So included in the rental payment is oxygen equipment, any type of the tubing or mouthpieces that you would have, the actual oxygen itself, maintaining and servicing the equipment, and any type of repairs. So there's a fee that is charged on a monthly basis for rental equipment. And that fee has to be used to basically pay for these services. The way the rental works, if you are in original Medicare, is that you rent the equipment for months 1 through 36. You, as the beneficiary, pay 20% of the Medicare approved amount after you have met your deductible. Again, if you have a Medicare supplement, that will pay that 20%. For months 37 through 60, medical or oxygen equipment is deemed to have a useful life of 5 years or 60 months. So the same supplier that you are using for months 1 through 36 has to continue to provide the oxygen equipment and the related supplies to you for months 37 through 60. Medicare continues to pay for the delivery of the either gas or liquid oxygen for those months, and you, as the beneficiary, continue to pay the 20%, or your supplement will pay that. After month 61, you can choose a new supplier, and this whole process starts over. Or you can continue to stay with the same supplier, but usually after 60 months, the equipment will be changed out and you will get new equipment. As I said, if you're in original Medicare, they're going to pay 80%, and you or your Medicare supplement are going to pay 20%. If you're in a Medicare Advantage, the majority of the plans that I looked at yesterday that were available in Colorado, the beneficiary paid the 20% out of pocket. So there is no coverage for oxygen and oxygen supplies for the 20% that is not covered by the Medicare Advantage plan. You can also, for oxygen, be charged for maintenance and servicing every 6 months if the supplier comes to your house and services the equipment. So they can't just put a charge in to Medicare and say that they serviced your equipment. They actually have to come to your house. They have to look at it. They have to make any adjustments, change out any pieces that they might need to change to be able to bill for that service. Other things, because we've seen a lot of turnover over the years in Medicare oxygen suppliers, is that if your supplier goes out of business, they do have to give you a 30-day notice in writing, and they have to specify specifically what date those services will end. They also have to provide you with a letter that you can use for the new supplier of your choice, and then they have to transfer your account to that new supplier with the effective date of coverage. If the supplier is no longer going to provide liquid oxygen, that is not something that they get to choose. They have to basically continue to always provide liquid oxygen. And if for some reason or other they do not provide it, or they indicate that they are going to stop providing it, then you need to file a complaint with Medicare. If you have any changes to your oxygen needs, so say you start out and you just have minimal oxygen needs, and then your health condition does not stabilize, but you need to be using more liters of oxygen, then your healthcare provider, your doctor, or your nurse practitioner needs to submit a new letter to your supplier indicating that you have a new script, and that you are going to need either more tanks or bigger or different equipment or whatever. But it's the responsibility of your medical provider to let the supplier know that there's a higher level of support needed. If you travel by plane, your oxygen supplier is not required to give you airline approved portable oxygen concentrators. You are basically on your own. Medicare doesn't really pay for any oxygen related to air travel. You can rent sometimes from either the airline or from your company a portable oxygen concentrator, which you can take with you. And sometimes some suppliers actually specialize in working with airlines and Medicare beneficiaries who need oxygen in flight. So talk to the airline and indicate you have a special need, and they may be able to help you as well. If you travel either for an extended period of time or you move out of the service area, again, for months 1 through 36, you work with the supplier and they have to find a new supplier in the new area where you are. So you could travel by car or you could travel by air. But once you get to the new location, either for a short period of time or for a permanent move, your oxygen company is required to help you find additional oxygen in your new location. Because oxygen equipment is, again, as is other stuff, deemed to be have a useful life of 60 months, your supplier is responsible for making sure that you have the equipment in the new area. And the one thing that they suggest in all of the information that I was reading is that if you are able to notify the supplier well in advance of your needs, that is better than waiting for a last minute kind of trip. So a CPAP machine is another type of oxygen pressurizing the air type of machine that you might need. This is primarily used to treat individuals who have sleep apnea and who are not able to relax at night. So they may lose sleep as a result of not being able to breathe. In order to get a CPAP machine and have it covered, you do have to have a sleep study. That is part of, again, the medical necessity that is required for a prescription to get a CPAP machine. You also, in this sleep study, have to reach certain levels in order for that to be covered. There is a trial period for 3 months where you can try a CPAP machine. Medicare will pay for it. They'll set up the equipment, and then you are, if you need it longer than that, then it goes into a permanent situation. The CPAP machines you rent for 13 months, and if you use it without any interruption, then it is yours for basically for the duration. The cost of it, if you want to buy it outright, is about $850. Medicare pays 80%, and you as the beneficiary pay about $170. Again, this is just one supplier. Other suppliers may have a little bit different pricing. Other types of continuous positive air pressure machines include BiPAP and APAP machines, and they work a little bit differently. So if you have one of those, we'll have to get that information. Another type of durable medical equipment that that Part B pays for is home infusion therapy. So basically, home infusion therapy has 4 parts, if you will. We have the infusion drugs. So basically, as part of the therapy, we have to have the equipment to actually infuse the drugs, whether that's a syringe or whatever, those supplies. So we actually have the drug itself. We have to have the supplies, the tubing, the syringes, the catheters, whatever that is used. If there's any type of a pump in terms of the durable medical equipment, and then we have the professional services of usually a nurse to administer those drugs. So all of those items, if you will, as part of this durable medical equipment are billed. And they usually are billed, they're itemized rather than billed as a lump sum, including the professional services. And in this instance, professional services, as well as the durable medical equipment, are all paid as part of Part B. So there are two different types of payments. One is the DME charge for the supplies and the equipment. And then Part B is usually charged for the antivirals or the immunosuppressants, although sometimes they do charge Part D, but not very often. And then they charge for, as I said, the equipment and the supplies. And then you get the nursing services. And what basically the goal of the nursing services here are that they are required to train and educate the patient and caregivers on the administration of these type of home infusion therapy. So family members, the individual themselves, are usually trained to actually work this equipment. They also are responsible for educating you on the side effects and the goals of the therapy. And the nurse usually will visit periodically to do an assessment to make sure that the infusion site is not getting infection. And if there are any type of dressings or anything, then it's their responsibility to change those. Paying for home infusion therapy, again, if you are in original Medicare, they will pay 80% of the approved charge. And then you, the beneficiary, are responsible for the 20%. If you have a Medicare supplement, they will pay that 20%. Again, when I looked on the Medicare Advantage plans, most of them were charging the 20% out of pocket for infusion therapy. So I think I may have seen one company that was making that available, but for the most part, it was an out-of-pocket expense. The next briefly is medical equipment. And this is one of the areas where I just did kind of an overview of the different types of walking, transfer, and mobility equipment that is covered under Medicare Part B. So under some terms and conditions, they will cover canes and quad canes. They'll cover those rollators, which are kind of the upright walkers. They cover crutches, walkers. Under some terms and conditions, they'll cover a lift chair recliner. They cover adjustable beds and mattresses. They'll cover wheelchairs and scooters, traction equipment, and then pressure reducing mattresses if you have certain kinds of conditions. It also will cover some types of bathroom equipment if there are concerns about safety in the bathroom. So they can cover grab bars, transfer benches, non-slip mats for the bathroom floor, toilet safety frames, portable commodes, raised toilet seats, emergency alert systems, handheld showers, and walk-in tubs are not as frequently covered, but they can be covered. So as with everything in Medicare, it has to be medically necessary. It also has to be what they call reasonable and necessary. So not only has to be medically necessary, but then you need it, and there has to be a reason for that. So if, for example, you're getting in and out of your shower and you get dizzy, it's reasonable to have a shower bench and grab bars. The equipment has to be can also be necessary for certain kinds of injuries or diagnoses, problems that people have, rehabilitation from surgery or from like a skilled nursing stay because of weakness or needing to stabilize. So there's a lot of different ways or reasons that you could qualify for this type of equipment. As always, you have to have a script from your healthcare provider, and then you need to purchase, again, as we said earlier, from a supplier that is approved by Medicare, and you can get that either by calling Medicare or you can visit their website. A lot of medical equipment, when I was looking at it in this grouping, also needed prior authorization. So before you would be able to buy, say, for example, certain types of pressurized mattresses or a lift recliner chair, most likely that would need to be prior approved or prior authorized. So the way you would get that is that you would have your healthcare provider, your doctor, write a script for it. You would take it to the supplier based on the information that the supplier gets from the doctor. Then the national determination group would decide whether or not it was medically necessary. Any type of this durable medical equipment in these two categories is deemed to have a 5-year or 60-month life from the day when basically it was prescribed. So again, if you get a wheelchair, then the deemed useful life is 60 months. For bathroom equipment and mobility devices is exactly the same as we've been talking about. Medicare pays 80%. If you have a Medicare supplement, it pays 20%, and you as the patient pay 0. You have a Medicare Advantage plan because of the way Medicare Advantage works, where the Medicare Advantage plan gets a per patient per month reimbursement from Medicare for all of their members. Medicare in this instance pays 0 directly. The MA plan pays their negotiated rate with the supplier, and then you pay the 20% out of pocket based on those rates. Some additional benefits in the way of Medicare durable medical equipment that Medicare Advantage plans may offer and may be very beneficial to you. So other things, especially in the special needs plans, some of the plans, and again, there are 10 Medicare Advantage plans offering insurance in the Colorado market. Not all of them are available in every zip code, and not all of them are available in every county in Colorado. So you would need to check that. Some of the additional Part B services, because Medicare Advantage plans have a great deal of flexibility in terms of how they spend their money that they get from Medicare. A lot of them will offer transportation for non-emergency care. So this could be things like rides to the doctor, rides to the grocery store, rides to the dentist. So it could be that. Some of the plans in the last couple of years have started to offer meals for a short period of time. This usually follows some type of a hospital or skilled nursing stay. They can offer home and bathroom safety devices over and above the devices that we talked about that are normally covered. A lot of them also are now, as part of the pandemic, offering telehealth services, which again is very helpful because you as the individual do not have to leave your home, but you can actually talk then to the healthcare provider. And a number of the Medicare Advantage plans, again, the special needs plans, specialize in this, is that many of them have some type of a catalog or an amount of money that you can spend for things like over-the-counter drugs, incontinence products, other healthcare needs that you might have. And they might have like an agreement with a Walgreens or Walmart or wherever. Colorado Medicaid. Also, if you are a dual eligible or if you have Medicaid only, will cover durable medical equipment as well. They cover oxygen, walkers, wheelchairs, bathroom, bedroom, safety equipment. Those are the primary areas where they cover. So a lot of people get the majority of their durable medical equipment covered by Medicare, but sometimes we have people who get that equipment through Medicaid as well. They can also pay for disposable or consumable medical devices. And this is things like diabetic supplies. One of the things that Medicare does not cover is the next two things, which is the oral enteral formulas and supplies. This is things like Boost or Ensure. And they also don't cover at the Medicare level the parenteral supplies. So those are only covered by Medicaid and not by Medicare. Medicaid always also covers if you have issues with incontinence. They will cover incontinence supplies such as briefs, pads, and liners. Again, we have to have documented medical necessity. There has to be a medical reason why you need these medical supplies. So if you are incontinent and you need briefs, then your Medicare doctor or your healthcare provider needs to write an order for that. Another thing that needs to be part of that order is about how many supplies you are going to need each day. So say, for example, you used adult diapers, you might want to have access to at least 4 to 6 per day. And if you have significant incontinence issues, you might need more than that per day. It's based on that estimate that goes into the script that then you get the prior approval from Medicaid for this type of equipment, and then it gets either shipped to your house or you can go pick it up. Most Medicaid services have limited to no copay, and it should be available again to all Medicare beneficiaries as long as they meet the medical criteria. So that brings us to a close at this point on the discussion on durable medical equipment. The next couple of slides talk a little bit about the Gerontological Society. We do have counseling and services available for Medicare. We offer those throughout the year, but we have additional support between now and December the 7th in both English and Spanish. If you are looking for information on enrollment in parts A, B, C, or D, we can help you with, if you're asking questions about a Medicare supplement versus a Medicare Advantage, or if you are just needing help and support through the Plan Finder to enroll or to change your Medicare Part D. All of these services are available in English or Spanish, so please feel free to call us if you need support. Other support services is that we can refer you to health insurance agents if you need help enrolling in Medicare supplements, Advantage plans, or prescription drug plans. We have a number of working relationships, both with companies as well that have exclusive agents, as well as companies that are basically represented by brokers and agents who sell a variety of products. We do have a few slots available if people are interested in having a clinical review of their medications by the University School of Pharmacy students. This is for people who may be looking at drug-drug interactions, or they may be experiencing some rash or other side effects, and they're trying to figure out if that's a side effect of the medication, if that's a side effect or a symptom of the advancement of the disease, so they can help with those kinds of pharmacological reviews. We have recorded all of our Wednesday lunch and learns, as well as our Medicare Zoom meetings on 2023 changes, as well as new to Medicare on our YouTube channel at CO Gerontology. So feel free to go out there and visit them. In addition to that, all of the prior year YouTube videos have also been recorded and are at that channel and on our playlist. Some of them are not going to be as relevant anymore, while others will be continue to be relevant. And so you could also visit us at senioranswers.org for more information. If you need to call us, our telephone number is 303-333-3482. Our toll-free number is 1-855-293-6911. And our Spanish line is 1-855-880-4777. And the next two slides are a little bit about the Gerontological Society itself and some of the services that we provide. We do vision, hearing, and dental services for low-income seniors. The vision and hearing services, we manage grant programs, are available in the Denver area. The dental services are available in the Denver area, as well as everything west of I-25, from the Wyoming border to the New Mexico border, and all the way to the Utah border. We do not cover Pueblo County and Colorado Springs or El Paso. Our Telephone Buddy program is available across the state as well, where we have volunteers who call older adults once or twice a week just to check in on them and make sure everything is okay. We are doing an advanced care planning series right now. There's also information on our YouTube channel, and shortly we'll be doing a session on guardianships if any of you want to register for that. Our holiday basket project we will be doing later in December. We'll be delivering about 350 baskets to low-income seniors, again, only in the Metro Denver area. Our education and advocacy, we do a salute to seniors, looking to do that in person next year. Our senior resource guidebook has been distributed through most of the local libraries in all of the little large and small towns around Colorado. And if your library does not have one, you can request copies. We did distribute between 8,000 and 10,000 copies earlier in the year. Our Medicare Monday programs have been some available in person and some have been available online. Our Stay Well news is distributed to about 30,000 households throughout Colorado. If you would like to get a copy of that, please let us know, and we're happy to make that available to you.